Welcome to Chapter 3, where I talk about the medical procedures related to surrogacy. So a lot of what I'm going to talk about today has been covered in Chapter 2, specifically in Module 1, Creating Embryos, and Module 5, where I talk about the embryo transfer procedures. But in this chapter, I go into a little bit more detail about the risks related to the procedures. But apart from that, everything is quite similar. So if we talk about surrogacy in the most basic terms, it's basically the implantation of an embryo into the surrogate's uterus. And so what this means is that there are two main medical procedures. One, getting the embryo, and two, implanting it into the surrogate's uterus. So in order to create an embryo, first, we need a procedure to retrieve the egg, which then will later be fertilized with sperm, and then that creates the embryo. And then second, we need to prepare the uterus for embryo implantation, which happens in the surrogate side. So as we discussed, an embryo is just an egg plus sperm, and it's created from the combination of these two. And now there's two ways to get the egg. One, the egg comes from the intended mother, if there is one in the couple, or option two, the egg comes from a donor. So let's say that you're an intended mother and you plan to use your egg as part of the embryo that gets eventually transplanted, that gets eventually implanted into the surrogate's uterus. Well, your first step is to undergo a cycle of IVF so that you can retrieve your eggs. An egg retrieval must be done according to the woman's menstrual cycle and the fertility clinic schedule. And so usually this takes about 1 to 2 months to complete one IVF cycle. So during an IVF cycle, a fertility doctor will usually prescribe a series of medications, and these medications are usually in the form of subcutaneous shots. So these are just shots that go in the tummy, and they're very tiny and they don't hurt very much. I know it sounds a lot harder than it actually is. And so the goal of these shots is to stimulate ovaries in order to produce multiple follicles, which will eventually produce eggs. So in a natural cycle without any IVF, generally what happens is that only one follicle grows and matures and only one egg grows and matures. But with an IVF cycle, the goal is to grow as many follicles as possible without harming the woman. These subcutaneous shots, or these stimulation shots, usually last about 8 to 14 days. So generally the woman takes shots every day for about 4 or 5 days, and then she starts going to the clinic where they will insert an ultrasound wand to check on the follicle growth. And at some point during the 8 to 14 days, her follicles will reach a certain size and the clinic will be ready for an egg retrieval. The egg retrieval procedure is relatively easy and painless. It's about 15 to 30 minutes. And basically all that happens is that an ultrasound guided needle will go into the uterus and grab the eggs from the follicles. Patients are generally sedated and do not experience much discomfort. As I mentioned in an earlier module, Module 1 of Chapter 2, there is a great deal of attrition when it comes to eggs. So on average, the fertility doctor will collect 8 to 14 eggs from the ovaries, but many of these eggs will be of low quality, and so many of these eggs cannot succeed in becoming embryos. So a typical example is one where 10 eggs are retrieved and 8 of them are mature. So 8 of them are mature enough for fertilization. Out of the 8, 6 fertilize successfully, and out of the 6, 5 make it to day 3 embryo status, and then 2 of those make it to day 5 embryo status or blastocyst. And it's important to know that about 50% of your day 3 embryos will make it to day 5. So the transition from day 3 to day 5 is where you usually see the most attrition in embryos. And a general rule of thumb, if you're thinking about budgeting for an IVF cycle, is that if you're older than 35 and you're using your own eggs, you should plan for at least 2 cycles of IVF. And many patients will actually need many more cycles than that. So something that I did not talk about before are the risks related to IVF. So the most significant risk in IVF is ovarian hyperstimulation syndrome, so OHSS. And this is an extreme response to the fertility medications, those shots, where the ovaries produce too many follicles and fluid from the follicle leaks into the body. So this is a relatively rare complication. It happens about 5% of the time, with severe cases happening about less than 1%. So this OHSS can occur either before egg retrieval or after egg retrieval. Another risk is ovarian torsion, and this is why doctors strongly advise against excessive exercise when you're taking these stimulation shots. You're building up your ovaries. These stimulation shots stimulate your follicles and then make them grow, and this growth increases the size of your ovaries. So if you do any sudden movements or any heavy lifting, the ovaries can twist, and it is apparently extremely painful. That doesn't sound very surprising. It sounds very painful. So these are things that you want to think about when you're doing IVF. One, when you're in the stimulation phase, don't do any excessive exercise or hard exercise, and keep your eye on and be aware of OHSS. Common symptoms of OHSS is extreme nausea, extreme vomiting, or common symptoms of OHSS include nausea, diarrhea, and extreme bloating. Another option to get the egg needed for an embryo is to get the egg from a donor. So in general, donor eggs cost more money than donor embryos, and this is because a lot of times the intended parents have to pay for the IVF cycle of the donor. And so in this case, intended parents should estimate a $25,000 fee, the fee to the donor and for the IVF cycle, etc. Donor embryos are embryos already created, and actually there's a huge supply of them. So in 2017, there was an estimated 1 million frozen embryos in the United States, and many of the parents of those 1 million do not plan on ever using them. So therefore, these embryos are routinely donated to couples in need. So with legal fees, the cost of using a donated embryo is about $10,000.